for 5 minutes.
My colleagues, this amendment is merely in addition to the report to the bill. About 2 years ago, we asked the Department of Health and Human Services to report back to us on what prescription drugs cost the federal government, those that from the Department of Health and Human Services, the VA, and DOD. We wanted to know the 10 most expensive accounts, what cost us the most, and then which were the most frequently used medications. Well, the Department of Health and Human Services took a long time to report back to us. They produced a report last year that was 6 months late and didn't really have the information in it that we were looking for. They claimed that in order to give us the spending information, it would violate certain proprietary rules that they have of not divulging confidential information. How that can be when it's taxpayer money is beyond me. But in order to get the information we're looking for, we are asking for another report, and this one is asking them to tell us how much they're spending for drugs paid for by federal and state programs, disaggregated by drug class. We're not asking for specific medications this time, although I really want to know that, but by brand name drugs, brand name biological products, generic drugs, and biosimilar biological products within each drug class. We feel that that will give us information that we need so that we can begin to understand how our pricing patterns compare to that of other countries. And obviously you all know how this issue matters to our constituents. And it's really been surprisingly difficult to get the Department of Health and Human Services to give us information that is useful and definitive. So I just ask for the support of the members in including this report language.
Thank you, Ms. Kaptur. Chairman Cole.
Thank you, Mr. Chairman. I'm going to reluctantly oppose the gentlelady's amendment, largely because we've just completed a study that, where we asked for almost the same thing, essentially from the last administration's Department of Health and Human Services. We don't think this report will do anything to enhance transparency or lower drug prices, which is my friends on the other side have repeatedly pointed out. The rate of growth, at least, in prescription drug prices has actually been declining. And we think it will take a lot of time and effort away from what they ought to be doing, which is modernizing the FDA under the dictates laid out in the 21st Century Cures Act. So for that reason, I would ask for no on the lady's amendment.
Mr. Lauro is recognized.
Mr. Chairman, I rise in support of Representative Kaptur's amendment, which will bring much-needed transparency to the federal government's spending on prescription drugs. Rising drug costs affect everyone, from seniors to families to children. As I mentioned earlier, this could be one of the ways in which we can address the high costs in health care and help to bring down those costs. Pharmaceutical companies are earning record profits, while patients and taxpayers face higher and higher costs. These companies grow their businesses with the benefit of taxpayer-funded basic research. They turn around and then gouge those same taxpayers without whom their drugs might not even exist. I realize the pharmaceutical companies invest their own resources to bring a new drug on market, and I believe that they should make a profit for their innovation. However, let me just point you in the direction of the Sunday New York Times, July 16th, in the business section. When Big Pharma spends, research isn't number one. Companies budget more for share buybacks and dividends, a new academic study shows. The paper's 5 authors concluded that from 2006 through 2015, the 18 drug companies in the Standard & Poor's 500 index spent a combined $516 billion on buybacks and on dividends. It's not about research. According to a report by Public Citizen, Medicare could save $15 to $16 billion annually by negotiating directly with drug companies rather than having individual insurers negotiate drug prices. On average, Medicare pays 83% of a brand name drug's official price. In comparison, Medicaid and the Veterans Health Administration pay only 48% and 46% of the official price for the same drugs. We need as much information as possible about federal spending on prescription drugs. I urge my colleagues to support this amendment.
Thank you, Mr. Lauro. To Ms. Kaptur to close. Ms. Herrera Butler.
I just actually have a question for the sponsor. I'm a little confused. Is it asking for aggregate totals on how much each of these agencies are spending, or is it asking, I think I heard in that last bit, you're asking for drug, apples to apples. This drug, how much you spent on this drug, same drug in this agency, how much you spent on this drug. Which is it?
You're yielding to the gentlelady from
I would yield to the gentlelady.
Ohio.
What we're asking, they won't give us proprietary information on any single drug. So what we're asking for is the information that each of these departments spends by drug class. So the identity of the medication is hidden, but we get a sense of how much is being spent by each of them. So we can get a sense of what we are spending.
A sense of how much we spend on, I don't know, pick a class per agency. Am I saying that? Am I understanding that right?
Right, they are in several
Mental health type
categories.
drugs.
They call them, let's see, I've got it here. I ticked them off.
Anti-diabetic.
By drug class and further disaggregated by brand name drugs, brand name biological products, generic drugs, and biosimilar biological products within each drug class. So you're not asking for specific names, you're just asking for the class of medications. So that protects whatever private interests might be worried about, but it gives us a sense of how much each of these departments is spending in what class. Because I'd asked last year for what are the 10 most expensive things we buy? What are the 10, whatever it is, I want to know. They won't do that. And then I said, well, then what do we spend the most money on? Aspirin, heparin? I mean, we don't know. So we're asking for, by class, what we're spending.
Thank you. I yield back.
Thanks, John. Ms. Pingree, you have time.
Great. Thank you, Mr. Chair. Well, I want to rise in support of the Kaptur Amendment, and I do appreciate that it perhaps is another study, and I know that was one of the concerns of the chair. But frankly, until we fix this problem, I don't think we can study it enough. I think some point we have to come up with a study, a comparison, some data that allows us to deal with what has become an increasingly serious problem. It's always been expensive to buy prescription drugs, but in the last 2 decades, and particularly the last one, prices continue to increase. And I think all of us know, we meet with constituents who say they often make a choice between buying those medications, putting food on the table. In Maine, it's paying for your heating bill, whatever it is, especially our senior citizens and people who have to take multiple medications. It just costs too much money. Now, I spent a lot of time working on this issue when I was a state legislator, and as the Senate Majority Leader back in the state of Maine, we passed one of the more revolutionary pieces of legislation that allowed us to buy prescription drugs and negotiate for prescription drugs using the Medicaid program. But prior to that, we didn't have any ability to do that. And it's time that the United States government, which only negotiates within the Veterans Administration, did that. We're like the only Western nation that doesn't negotiate for better prices. We pay the highest prices in the world. Think of it this way. When our governor talked about the bill at that time, he said, what if you were on the airline and you were the only one who paid full fare and everybody else was in a cheap seat? And that's what it's like for us. And we shouldn't be doing that in government purchasing. We shouldn't be doing that for our seniors. In my state, people cross the border all the time because you can buy the exact same medication, sometimes for 1/3 the price, just by crossing the border. Same package, looks exactly the same. There's just no good excuse for this. And there's no good excuse for many of the things that happen in the pharmaceutical industry. I know they put money in research and development, but as my colleague said, a lot of it goes to buyouts, stock buyouts. Frankly, a lot of it goes to advertising on TV, which wasn't even allowed before 1993. That's an excessive use of something that we don't need to see. None of us need to see those 20 minutes of disclaimers every night that make us afraid to take practically any prescription medication. So I just want to say this is a good piece of, this is a good amendment. We should be doing so much more, and I commend my colleague on this and suggest that all of you vote in favor of it.
Thank you, Ms. Pingree. To close, Ms. Kaptur.
Thank you very much. I don't think it's good for any of us to fly in the dark. And this is one of those issues that I think the more we know, the more responsible we can be. We know Americans spend about $1,000 each year on prescription drugs compared to about $700 for Canadians and just $300 for the Danes. So there's great disparity across the world. But right now, no one here can really accurately indicate how much we are paying this year for these various medications. And our language doesn't ask for the specific medication, it asks for the class of medications. Prices of drugs are expected to rise 17% in our country. And the United States government is the biggest consumer in the marketplace that helps set the price for individuals who simply can't afford these rising prices. So I ask for inclusion. This is simply asking for information. It's an amendment to the report.
I thank the
And
gentlewoman.
I beg my colleagues' support on this.
The questions on the Kaptur member. All those in favor say aye.
Aye.
All those opposed say nay. Opinion of the chair, the nays have it. Amendment's not agreed to. Roll call. We're going to do